You're listening to Community Health Watch on WNHHLP 103.5 FM, New Haven's home for community radio. Insightful conversations, impactful ideas, and voices shaping our community and beyond. Let's begin the dialogue.
Reverend Morrison, are you going to lead us off?
Certainly, Dr. Perry. I'll lead off this morning. Good morning, everybody. We are grateful to be here together again. We are glad to have our sponsoring radio station, WNHH 103.5. We've been in a series of conversations as we've been talking about how the faith community can partner with the health community and clinical trials, especially as we've gone into this, but the health community, and really affect change in our cities, in our communities, in our neighborhoods. We've had some great success so far, and today we want to continue the conversation. We want to continue to really talk about where our community needs us the most. I'm glad to have my co-host here this morning. I want them to introduce themselves, and we'll introduce our special guest.
I'm Leroy Odinga Perry from the St. Stephen's Amy Zion Church. I've been a cultural ambassador for Yale YCCI for the past 16 years. And we've been doing this radio program for about 4 years now. And we're just so happy, Gabrielle, that you and your team have decided to join us today, because we're on the same battlefield, seeking to do the same work. And now we're able to collaborate, and maybe we can even do the work better.
I am Elvin Clayton, pastor of the Walters Memorial Amy Zion Church, Bridgeport, Connecticut. Have the nickname of the Park City. I've been a cultural ambassador for 15 plus years, and I'm excited to hear what you have to say to us today, Sister Gabrielle.
Thank you.
Yeah. And I forgot to tell you that I am Eldrin Morrison, the pastor of the Shaw Temple Amy Zion Church here in the Atlanta area in the city of Smyrna. I used to be a pastor in New Haven, Connecticut, where I got a chance to grow and to meet these great pastors, and certainly to be a part of YCCI from its inception. And I loved it so much and love this work that as I moved south to Georgia, they allowed me to continue to work with them, and I appreciate that. And just a few weeks ago, it was Tisha Harris that was talking to Howard Mosby and needed a place in Georgia, in Atlanta area, to host a series of community conversations with the Heal Collaborative. And somehow or another, we got linked together there, and we were able to really host this at Shaw Temple. I had a great time, and I got to meet our guest, Gabrielle Jones, who is here who is here in Atlanta from Decatur, and certainly a part of Heal. I'm going to allow her an opportunity to just introduce herself, and also to tell us about this great organization, the Heal Collaborative.
Thank you so much. It is an honor to be here with you all today. We thank you so much for allowing Heal to be a part of your initiatives, and we're just grateful for this partnership. Heal Collaborative is actually Health, Education, Advocacy, and Learning. That's our official name. And we were founded about 9 or 10 years ago. We are a national organization, and we're headquartered in Atlanta. However, we have a regional footprint around the country. And the mission of our organizations is to ensure that communities of color are healthy. It's very simple. Our work is very community-based, where we partner with different community organizations. The faith communities happens to be like the foundation of what we do. So we partner with the faith community to collaborate on health education programs. And I know when we say, you hear that word so much, health education, but we pretty much do a pretty deep dive into these different chronic diseases that are impacting our communities specifically, looking at disparities, the prevalence of these diseases, including, I mean, when you think about the health system and the lack of education that's happening at at the community level directly in our communities. It's very nuanced. I mean, the system is very complicated for a lot of our communities. And so our work specifically focuses on those different aspects of diagnosis all the way to survivorship. So that's what we focus on. We look at what a diagnosis is, how you get screened, navigating the healthcare system in terms of just getting through the process of a diagnosis, transportation, care, across your healthcare providers. And then we also talk about clinical trials. I know that's something that's controversial still in our communities. However, we're seeing that pretty much it's becoming more. We're having better conversations about clinical trials and our participation in clinical trials, and we should be looking at it as a viable treatment option, not just something that is, you just think about and move on. There's a lot of good therapies out here, so we want to make sure that our communities at least know what their options are, and then they can make a more informed decision about treatment. So that's the clinical trial piece. And then we want to talk about different, like the financial cost of a diagnosis. So that's important too, because a lot of people don't get screened because they don't think that they can afford to have to get the treatment or the care they need. And then lastly is we have to talk about policy issues. And I know that's on the forefront of everybody's lives right now, what's going on federal level, but also the state level. So we have to talk about advocacy and why it's important that we understand the policy implications of our access to care, treatment, the social determinants of health, everything that involves that, and some of those non-medical issues that we're facing as well. So I kind of stopped there as I kind of went deep dive into it.
Awesome. Can you kind of go back and talk about how you got connected to Heal Collaborative and maybe your background, but also what inspired Heal Collaborative? How did this really get started?
Yes, sir. So I started actually with Heal Collaborative prior to them becoming a 501c3. My background is the pharmaceutical industry. I spent my younger years with working with the medical device industry out of Washington, D.C., and then went on to work for the pharmaceutical industry, mainly around policy, but also what we called back then alliance development, because the industry saw that not enough was being done at the community level in terms of education and engagement, particularly in the African American community and other brown communities. So that's my background. And I got connected with Heal actually through Howard Mosby, who is one of the co-founders of Heal Collaborative. I knew him when he was serving in the Georgia legislature. He was actually a state legislator for 16 years. And if you think, I don't know if anybody is really familiar with the pharmaceutical industry, a lot of the access issues or policy issues that impact our ability to get access to these treatments, Howard actually sat on a committee that we talk about this now, that those bills that landed in his committee, which was Health and Human Services, I would go to those hearings and I saw, this gentleman there that was, pretty much debating these issues around access. So that's how we first got connected. It was my role with pharma and then working on some of these policy issues.
Wow. So I can say that a few weeks ago, Shaw Temple was just blessed to be able to host Heal Collaborative in conjunction with a pharmaceutical company, Kite, I believe it was.
Yes, Kite.
And our community.
Yes.
We had two phenomenal days. I rushed back from a meeting to be there Friday and Saturday to turn around and go back to the meeting because I thought it was so important for us, for me to be there personally as a pastor, but also to see all that was going on in our community, not only our church members, but the large community where our church serves in Smyrna. and we hosted a series on multiple myeloma, which is a blood cancer.
Yes, sir.
And we learned so much that those 2 days. We had about 100 persons
Hmm.
days in terms of in person and then online and everything. Um, can you talk about how do you pull that together around the country? How does that happen?
Yes, sir. First of all, it takes committed community leaders like yourself. We have to find faith leaders that understand their congregations and the needs of their congregations, particularly the health of their congregations, because that's very important. I have I hope I'm not out of line here, but I've said this over the years when I talk to faith leaders. I said when people are sick, it's hard for them to tithe and it's hard for them to volunteer. So we have to address their health. We have to help them understand that this is our temple, and not just know what those medical issues are, but truly understand. We have to be better informed about our health, about prevention, about the importance of screening. So it takes leaders like yourself, Pastor Morrison, that understand the health of your not just your members, but the outside, the unchurched community and what they're dealing with, and educate them around a lot of these health issues where they live, where they serve, at the community level. So that's where we start. So we find individuals like yourself, and we start to build out from that, because our communities there's so much value in the people that are in our communities, whether they're civic organizers, whether they're businesses, civic centers, senior centers. These all represent our communities, and there's so much value there that we bring everyone in.
Mhm.
So the foundation of what we do starts with our faith leaders for the most part.
And can I follow up just and I'll allow my other co-host to really share as well. But what is it that Heal wants the community, the church, the pastors, or whomever to leave those sessions with? I mean, I knew I left with a greater awareness of some of my members who had who have some symptoms of things, and I was really blessed to see them so attentive to what was going on and what was shared. But when Heal leaves, what do you want the community to walk away with and that local congregation or organization that you're partnering with?
Absolutely. That's a great question. We want people to be better informed advocates for their health. And
Mm,
we want our faith leaders to recognize the importance of a healthy, educated, informed congregation of, 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 um, of people that now understand what the healthcare system looks like. We should never have to that learn that there is someone called an oncology navigator when we end up in the emergency room. It's important that we know these individuals that make up a care team, who they are before we get that diagnosis. We tend to have these illnesses at stage 4, when sometimes it's harder to treat. But we hope that people walk away feeling more empowered,
mhm,
more educated, more informed, so that they can advocate for themselves, so they can make better informed decisions, know about their treatment options, what's available to them. Also, to remove some of the stigma that's associated with just having any disease in our communities. So often we just don't talk about things. We don't feel that there are safe spaces, whether sometimes it's in our churches or community centers, because we don't even talk about it within our families. We don't know our medical history. So we're just hoping that people walk away feeling more empowered, more encouraged, have more hope because they've gotten this information, and that they can take action now,
mm.
on behalf of themselves if they're a caregiver, that what they're experiencing is real to them, and that we can continue this dialogue. We can continue feeding information out to our communities in a culturally relevant way.
Mm. Appreciate that. Yeah. Um,
Gabrielle, I've met Howard on a call. He was looking to do a liver screening in one of our churches in the Midwest. And I was pleased to help him get in contact with the people that he needed to be in contact with to make it happen. One of the things that I'm interested in is like we are at YCCI, we started similarly by doing education awareness, basically looking at the disparities within our population to our white counterparts. And I think that's what got our interest. And, our biggest challenge was trying to get people to take charge of their health. I mean, even as faith leaders, you can bring them to the fountain, but you can't make them drink. And so, I'm wondering, do you have any suggestions as to how you might be able to uh, work with the hesitancy that we find, even as faith leaders, that we have within our church and within our communities? Not every faith leader is the same.
Right.
That's for sure. And the mere fact that our team has been trained by um, Yale School of Medicine with more than 40, sometimes 100 or 200 or 300 hours of medical training, like IRBs and consents, and how to go online to look up clinical trials. So I'm just wondering. I know I really like your title, "Caregivers Conquering Cancer." That's powerful, and I
Yes, sir.
know sometimes you need a phrase like that to draw people in to to bring them into the awareness, into the room, because you got to have some hope.
Yes.
You got to give them something. One of the things that I'm wondering, are you connected with any hospitals or any clinical, any pharmaceutical companies that are helping to help you, with this task, this gargantuan task of making us aware and putting us where we need to be in position for better health care?
Yes, sir. So we every city that we partner and do an engagement with, we do work with those local health systems because that's where we get our speakers. We have to identify healthcare providers, specialists that are really committed to coming outside of that healthcare system and working directly in the community. Not everybody can do that, and you don't want everyone in front of your community. It's those that are committed and understand the disparities. They understand the lack of information, that the right information is going into our communities. But they also understand that we are being bombarded with so much information. But how do you narrow that down and make it very specific for our local community? So we do work with health systems. Also, we have great sponsors. We have great pharmaceutical sponsors that are committed to this work that we do. Kite Pharma is one of them, and when it comes, patients are at the core of what they do, and they understand too that not everybody's getting access to these innovative therapies that are out there because there are a lot of challenges of policies that are kind of restricting access or delaying access to these treatments. So yes, sir, we do have that. Now, your earlier question about how do we get people to take action. Heal does focus groups. So we always want to hear directly from patients and caregivers, because when you do small groups, as you know, because the church has small groups, that's when you really connect with people, and you get to hear those things that they're not necessarily open to saying in a bigger audience, where people feel more connected when they hear that someone else is kind of dealing with the same issues that they're having or the same challenges. But it also brings hope because they can see someone surviving that diagnosis and what they're doing and gleaning from that. So we like to do small groups. From those small groups, you now have ambassadors. You have people that you can put out there in front of a larger audience that are sharing their journey and what they're going through, including that caregiver, because the caregiver is dealing with just as much as if not more than the patient. The patient has a diagnosis, of course, and they're having to navigate the healthcare system, but that when you're talking about a condition like multiple myeloma, it does require that caregiver to be just as involved, just as educated as the patient while they're going through their diagnosis and their journey. But also that caregiver is dealing with the burden of being a caregiver and everything that comes along with that. So I think those personal stories, you have to get those out more within the church. You have to allow people to share their journey, but their journey of hope doesn't mean that there aren't going to be challenges, because there will be. But it's that journey of hope and faith that they have in getting through this. When you hear, the numbers out here, I think we talked about this when we were, and Pastor Morrison, we were at your church, is the people, I think it's out there like 5 years survival rate. And then you see people that are living much longer.
Yeah.
That gives people hope. But you want to hear what that hope looks like. What did their journey look like? We need more stories like that.
Yeah.
Even our sponsors are looking for those great stories that they can share as well, that give people hope.
Mm-hmm.
I would like to
go ahead.
First of all, we're listening on WNHH 103 FM. Gabrielle, I have a question that I want to, hopefully you can help me with this. Is there a plan in place to help the patient work through this political climate so that they can have added hope and don't leave with a broken spirit?
How do we have hope in this political climate? Is that what your question is?
That would help, yes. Or is there a working process that HEAL has to help people through this political climate with the cuts and what have you?
Absolutely. Because I'm a follower of Christ first. So I say I trust God first in whatever we're dealing with, first of all. And my faith, we will get through this. Now, as an organization, because it is foundation, we see this as a ministry. We see our work as a ministry. When we think about it, we all could be doing something different, but this is intentional work for us. I would suggest people get involved in, it's not politics. I suggest you get involved in what's happening locally on policy issues that are impacting your communities. And it's not just health. I mean, there's education issues, there's socioeconomic issues. I mean, the threat is huge. And so HEAL provides a platform where we normally will do a policy discussion. We didn't have that was not a component, Pastor Morrison, for this program, but we usually like to have a political discussion, letting people know what is currently happening politically, policy-wise, that impacts their care. So we do try to have legislators on a panel to talk about those policies, but also what's happening if there is a federal component or a federal implication. We try to have that discussion as well. And it's not just legislators we try to have on that panel, but active citizens. I mean, people that maybe are connected with a local advocacy group that is also working on that political issue or that policy issue locally. We like to have that discussion on a policy panel and then open that up to our attendees so that they can ask questions. After doing this for so many years, and when I would travel around the country, when I worked for pharma, it broke my heart not to see us at the state capitals. There was always someone there representing us. And if they're representing us, our voices truly aren't being heard. So HEAL, foundation, another foundational component of HEAL is making sure that our communities understand these policy issues and how they impact us locally at the state, because the states move quicker than Congress does. Well, if you look at it now, you would think that Congress is moving stuff quickly. That's because of all the executive orders. But I won't go there.
Yeah.
Normally, at the state level, these issues are happening quicker. bills are moving through the legislature quicker at the state level. So it's important that we know, first of all, who our state legislators are in our districts. And then what are some of these policy issues that are impacting our communities?
You know, I want to say that Reverend Morrison has been on doing this kind of work for a number of years. He was one of the founding principals in our YCCI Cultural Ambassador Program under Tisha Johnson Harris, and it was because of Tisha Johnson Harris' work in bringing the number of clinical trials to underserved population in New Haven. We started at 3%, we got up to like 10, then 20, then 40, then 60. And Pharma saw the work that we were doing. And we were told directly from members of Pharma that it was because of Tisha Johnson and her work and the work of the Yale Cultural Ambassadors that they started the EQB Med program. And Reverend Morrison, Reverend Clayton, and myself, we were trainers for the EQB Med project funded by Pharma, now CTAC. And then we went into Florence, South Carolina during the, what do they call it? The corridor of shame. And we reached out to underserved populations, educating them.
Yes.
And that was the first phase. And then the second phase was which we're working on or going to be working on, I hope, is implementation. How do you get those who need, how do you get the funds for those who have no funds to be screened for blood cancer or for prostate cancer or for, you know, all of these disparities that affect us, particularly as you said, in this political climate that we're in. And I salute the Black church because I'm gonna tell you, had it not been for the Black church, we'd still be picking cotton.
Yes. Well, first of all, I do want to acknowledge, Reverend Perry. I love this program that you all are involved in, and work and the progress that you've been able to make. Not making the word clinical trials, the boogeyman, and
Right.
kind of moving us, remembering, but also moving us through this process that we are proactive now in talking about this, talking about clinical trials, and actually helping people to get access to clinical trials and through that. So I commend you on that, and then the great work that you're doing. In terms of screenings, if you think about different screenings, whether it's on cancer screenings, it's about the cost of screening and access to screenings. We're going to Detroit to do a lung cancer program education, particularly focused on African American men, because there are low screening rates for lung cancer. And if you think about lung cancer, lung cancer screening. It's the only screening that is based on behavior. That's how you get screened, and eligibility to get screened and get it covered, right? So the cost of screening, I think there are enough programs out here that we just have to be proactive in asking what is available and what that cost is, and then getting assistance with the coverage of those types of screenings. But I'm not a clinician, so I apologize. I don't. I'm trying to answer your question, but coverage is an issue, depending on if you're uninsured, underinsured, across these different types of screening. So, but I think there are programs out there that make sure that we do get access. We just have to get beyond the stigma and the fear of getting screened.
Mm-hmm. Yeah, I want to jump in with that one. I know during our workshop in Smyrna, and we heard all about multiple myeloma cancer and the rates and everything. And then I think it was day 2 where you shared that the PROMISE study was going on, which is a study, clinical trial study that was going on, and it gives you screening for free.
For free, yes.
And so we sent that out to our congregation, our persons that were there. There's so much out there that we don't know.
Mhm.
That was, I mean, it was almost, I guess you planned it. I don't know, to tell us all the information first and to get people's, like, what if I have these symptoms and thing, and then tell people, listen, there's a promise study out there. It's free. You need to make sure that you get to that website and you get the information that you need so that you can be a part of this screening as well. But I wanted to say that I was so impressed with Kite, and they stayed the entire time for those 2 days, and they were so engaging with our community as well. And you don't usually see that from pharma, big pharma, really.
Yes, sir.
But they were engaged. They were asking questions and answering the
Yes.
things that we needed information on. So I really appreciated that collaboration with Heal Collaborative.
Thank you for that, Pastor Morrison. And thank you for remembering the promise study. So it's important when we find our speakers, we tell them this is a community that we consider, no matter where it is, underserved. And what we mean by that is they are not getting the information, or they have to go out there and find it themselves. So we want to help in this setting where we are, that people get this information directly from you. And so that's when we as we're going through the process and planning this out, we have individual conversations with our speakers about what the expectations are and what our objectives are. So thank you for mentioning that. Now, in terms of Kite and some of our other sponsors, we always encourage them to come out and be a part of it. And they want to be a part of it. They want the community. They want the community leaders. They want you all to know how important this work is and how much, that they are willing to continue to invest in this work, but also be present because they want to hear from you. They want to go through this experience with us all in person. And that's why they participate. Most of the time, we only see the commercials, you see, and sometimes you don't think these are real people, but they are. Yeah. And they want to be involved, especially when you're talking about health equity in our communities. It's important that they have a face, that we can put a face on these individuals that are out there, doing this research, that are developing these new therapies because they're developing them for people to have access to them.
Wow.
I think that gives pharma a facelift.
Yeah.
Absolutely.
Because normally folk think of pharma and pharmaceuticals as only an industry that preys upon the sick and, peddles pills for profit. That's why I think that the EQB Med project that was at Yale, and they collaborated with Morehouse
Yeah.
and with Meharry and TSU to say, no, it's more than that. There is a disparity that we need to look at. And if there are not enough African Americans or minorities in these clinical trials, then the final product may not work. And so so everybody benefits by this collaboration. And I think that, morally, we all, the schools, pharma, the religious leaders, morally, we should be obligated to work together, to collaborate together. Because when you said you're a Christian, you know what the mandate of Jesus was. We got to visit the lost, the
Yeah.
sick, the
Yeah.
poor, the downtrodden, and as Howard Thurman talked about it, he called them the disinherited, and that's where we need to be.
I like that. And after, when I think back to my younger days when I worked for pharma, and I saw the lack of engagement in our communities, but it was because we weren't represented. There were not enough organizations that were representing our communities. And so over the years, it's been good to see that we have stepped up as communities to say our voice matters. We know our communities better than anyone else. And there's still a lot of work to do to do that, but it has to be consistent too. We just can't come in and out. That's why we always, whenever we work with whether it's a church or community center or whoever our local partner is, that we want you all to invite us back because this information has to be consistent because this stuff is happening in real time. in terms of information coming out on these different chronic diseases and then the treatment that goes along with it, is that we remain consistent in getting the information out to the communities. And we can only do that through these types of partnerships. But yeah, the pharmaceutical industry, from what I know, and I'm not just saying that because I've worked for them, but I know at the heart of what they do is patients getting access. And if you don't need a treatment, you don't need a treatment, but at least you know what's available.
Mm-hmm. What drove you to Shaw? Was it the pastor or was it the community? Uh, you saw him on the radio or the TV. There were some members in that community that reached out to you and said, "Hey, let's go over here to Shaw." What was it? Because we know he's very charismatic, and we're just trying to find the secret to his sauce, to his success.
First of all, he's so humble and he's just so great to work with. My goodness. I will have to say it was Miss Harris that connected us first. But after that, it was just a natural fit. He was so open to doing this and just encouraged us along the way in the process and very much involved. And that's important. Even though I know his schedule was tight, but he made himself available and his team, and we appreciate that. Because it is a huge task for our faith leaders, because you all have so much on your plates. Your commitment to the congregation and just time for yourself and all the other things that you do. But making time and being present, that speaks volumes. You serve as a great example of other community leaders, what other community leaders should be doing. Because we know in our communities that trust is important. People listen because someone says you need to listen, you need to be here, because this information is important. So as an organization, we rely on that heavily with our community leaders.
One of the things that we realized early on was that before we could reach our communities, we as leaders needed to be trained. And I think that's important because you have some faith leaders who rely totally on a kind of faith notion that as long as you say it and you claim it and you believe it, it's so. And to the exclusion of what the Lord has already provided in terms of the researchers and the folk who spent years and years to prepare themselves to do the kind of research to bring about these new evidence-based successes in terms of vaccines and other things. And so, I mean, it's like if you have some preachers who think that diabetes is just a question of sugar and all they got to do is stop drinking the Kool-Aid or call on Jesus. But you have to train the ministers, the leadership, the community, because if these faith leaders don't have the training, I used to call them bush preachers. I don't call them that anymore. Someone said that wasn't nice, but we all need the education. And I think that what you're doing, you're finding the leaders who are open up for this kind of education, not the leaders who say, "Oh, if you give them a vaccine, they're gonna end up with Alzheimer's or some other kind of disease or disparities." We need to train our leadership. Education is so important, and then the second thing is to, like you said, making ambassadors of the ambassadors to bring about a larger multitude gain in terms of trust and understanding. And I think that with Morrison, you hit a home run because he brought your name up to us to be on this show because you've done such a great job where you were. How do we get you in other places, or you know how do we get you to come to Bridgeport to where Reverend Clayton is? And he's got a monsters church there, and they shout and they do all the things that the Pentecostals, the Methodists, and the Methocostal people do. But they need, other than Jesus, they also need to hear about health equity and disparity and the promise of hope.
Well, we will go and serve wherever we are invited. I mean, a lot of times we have to go hunting for that. There are targeted cities that we try to focus on depending on that disease or that chronic condition. We were just talking the other day about where this, again, lung cancer, because it impacts our communities at such a high rate, and the screenings are very low. And so we just started doing research, like what are some of the cities that have the highest rates of smoking? You have to start there. And where can we have an impact? And so you find these little towns in the middle of nowhere, and you're like, okay, so is that where we need to go? Then that's where we need to go. But we will go, to answer your question, Pastor Perry, wherever we're needed. We love to have those discussions with you about what does an engagement look like, an education engagement look like that can have some meaningful impact with your congregation and the communities that you serve.
Now, do you have to partner for the screening? Do you have to partner with a health group
sir.
in the area?
Yes, sir. So when we find our healthcare providers that are going to speak, and as you remember, Pastor Morrison, the 3 health systems that were represented there was City of Hope.
Yeah.
I think Winship, Dr. Shepherd was there, and then Northside. So we were able to get healthcare providers from all 3 of those health systems to come out and speak and share information that they would take into another community. But we just wanted them to be there specifically to address our communities.
My colleague, Reverend Perry, kind of stole my question, but let me go here. What support in terms of volunteer sponsorship or media partnership would be most helpful to further your mission, not just in your area, but in other parts of the country?
So in terms of volunteers, so when each one is different, depending on the partner. If it's a church, we do try to get that church to have maybe some of their members participate or help kind of pull through on the program. In terms of sponsorships, that's, as a nonprofit organization, we have to fundraise. So, and that's pretty much our leadership. So that would be in Howard's wheelhouse in terms of, so I oversee our programs. That's pretty much what my role at HEAL is. So I oversee every community engagement program that we do around the nation. And so when I say oversee it, I'm involved in every aspect at every level of every program. Where we are, what we're doing, who the speakers are, managing the execution, the strategy, and the engagement of all of our programs. So that's kind of my area. It's more over there, and on the sponsorship part, that's more of Howard. Does that answer your question? I'm sorry, I didn't want to get away from that.
Okay, that's fine. I need to remind our listeners that we are listening on WNHH 103.5 FM.
Gabrielle, I have one more question I want to ask you about clinical trial recruitment. Do you keep statistics on the recruitment that you do for clinical trials within the organization?
No, sir, that's not an area so we do the education around the importance of people considering clinical trials, it's really understanding first, getting people to understand what clinical trials are. The changes that have been made since a lot of the past issues, where we are today. And then, again, making sure that people understand that it can be a treatment option. And we should be having those conversations with our healthcare providers proactively, asking, is there a local trial that I can get involved in for what my condition is? Having that discussion with your healthcare provider, understanding what that process looks like, inclusion, exclusion, everything that's involved in that. We want our communities to feel confident and comfortable having those conversations. That way, you know what your options are, and then you can talk about that with your family. Um, do some research on whatever those trials are, and then make that decision. So for HEAL, we are educating our communities, informing our communities so that they can be better advocates for their own health care.
Do you find women as a subject, as a main target group for disparities?
Uh, yes. However, women are more they're more active. They're more involved.
Mhm.
They're I won't say they're better advocates. They just do more. They show up more, just like in the church.
Thank
you
God.
know, we're there. I think we can do a little bit better in terms of getting our men involved. Um, because if we show up, we should be bringing our sons, our husbands, our uncles, along with us as their support, so that they can learn with us and be more involved. But yes, women, we do stuff. So
Right. That's right. Could I do want to say that as you were talking about the cancer treatment, especially you mentioned the next one coming up in Detroit. I just kind of reflected for a moment. This weekend, literally in 2 days, we had a memorial service for a member who passed away with cancer. And on yesterday, learned of a former member who's just moved away from out of state from our church a few years ago, passed away with lung cancer.
wow.
These cancer sessions that we're having are so very important because as much as treatments and things are out there, it seems that our people know less and less about the trials and about the newer treatments options that we have. So it's so important to get this information out. And I have a question that I'll tell you what I really want is I'd love for you all to come back to do with the policy piece of this because
Mm.
we have so many, at least in Cobb County where we are, there's so many of the policymakers, politicians who are in our community, and I'd love to get them together and to talk about what we can do in this political climate in terms of information and for help for our people. I really want to know how do you do that, but also how do you gauge whether or not one of these sessions that we've had, like the 2 day session or how many days you have, how do you gauge whether they have been successful and well, yeah, how do you gauge whether they've been successful? Because in the church, we
Mm.
preach a sermon, we think, well, if people hear it, it's been good. If one person gets saved, it's wonderful. But when you are really putting a lot of resources, as you all do, into each one of these meetings that we have, how do you gauge whether this has been successful and this is something that we can come back to?
Great question. So I love the idea about a policy discussion. That is definitely needed. And I think the timing would be great for to do something in Metro Atlanta. So absolutely. Um, the follow-up. So we do a survey. As you know, we collected a survey. We're
Mhm.
going to be collecting all the data from that survey, and you will get a copy of the final report.
Oh, okay.
Okay. And then within 60 days, we like to do a follow-up or a focus group. A follow-up is just reaching out to the attendees. So, okay, what have you done differently as a result
Okay.
of this? It didn't have to be connected directly to multiple myeloma, but just as a caregiver, having a loved one who has some form of cancer. Did you learn something at this program as a caregiver and what you can do better, right? And then secondly, on your next appointment with your provider or something coming up, how was your conversation different this time? Knowing now that you're better informed about your overall health and what that means. What steps did you take to do something different? That's kind of how we know if people the information was relevant for them and it was
Mhm.
something that they could actually act on and do differently.
I see.
So we will be, reaching back out to your, just, a survey of, because of course, we have people's contact information when they signed up, but what does that look like? So those two things, because it is important. Usually well, not usually, the attendees help us inform the next engagement, because it's important that we listen. You just can't do a program. You have to listen to what people are needing, what's important to them, so we can act accordingly, right? Because what you'll find is some of the same themes that people have. When you get people together in a room, they kind of, have the same concerns or the same similar journeys and things that they're dealing with. So that would be the next step.
Gabrielle, do you do a session on mental health? I'm just curious to know, because that's a major thing in our nation now.
So we don't necessarily do one on mental health. However, for those chronic diseases where we know that there are behavior and mental health implications, we have a speaker. So the one coming up that I mentioned in Detroit, we actually have, so when we're looking at lung cancer, we're looking at veterans too. 1 in 7 veterans are diagnosed with something called small cell lung cancer. It's more aggressive type of lung cancer, usually because of their history being, in the military, whether it's smoking, but exposure to toxins and burn pits and things like that. So we have an actual licensed clinical social worker whose specialty is in mental and behavior health. So she's going to be speaking about what that, a lung cancer, what that diagnosis means. She goes deep in. She talks about suicide prevention, risk reduction. If you have a lung cancer diagnosis, how does that impact not just your mental health, but your behavior health? So it's not necessarily a session, a half a day or 2-hour session on mental health, but we make sure we address it within the program.
I think that's so needed. That is so needed, because they piggyback. It's like you get, people who have chronic diseases like lupus and sarcoidosis. They also have mental stress and deal sometimes with hopelessness. Like, am I ever going to be cured? Am I always going to be sick? And we never really address those issues because we're trying to find the quick fix. And I think it's important that the educational process is integrated like you have it here. I think that's amazing.
Yes, sir. That is a component. So you just can't get around that. Whether it's I'm going to say common, or whether it's a common disease like diabetes, or a rare disease, not necessarily so rare, lupus or sickle cell. Some of these chronic diseases, because we don't talk about the mental health aspect of that. Just having the diagnosis and just going through treatment, going through your journey, sometimes you do feel alone in that process.
Yeah. We've got just a few minutes left. Gabrielle, we want to thank you for coming on and being a part of our show this morning. As we wrap up, let us know how we can be a part of the next sessions, or what Heal Collaborative is doing. That Detroit one sounds very important. I wish I could get there, but can I do it online?
Yes.
How do we know what Heal is doing if you're coming to where we are?
Absolutely. So all of our programs are streamed, so you don't have to be in that city to watch it. We make those available on our website, so you can watch those, even the one coming up in Detroit. But
healcollaborative.com or
yes, healcollaborative.org. We are on Facebook. We also are on YouTube. So we make sure that those programs are available for anyone who wants to watch them. So that's how you can be involved. And again, following up with you, Pastor Morrison, to talk about that next engagement.
Yes.
And Pastor Clayton and Pastor Perry, let's have a discussion about, how we can build out a program with your ministries.
Yeah. Well, I personally want to thank you. I've learned a lot sitting here today, and I really appreciate this dialogue, this collaboration, this conversation, and we have to do more of this. And this might be another arm for your outreach, to just have these programs with the leaders. Reverend Morrison can hook that up for you, and we'll be right there with him to help in any way we can. Thank you again.
Thank you. We appreciate you. Thank you so much.
Yes. Clayton, you have any? All right. Well, I want to thank everyone, our listeners especially, for joining us here at YCCI's Community Health Watch show right here on WNHH 103.5 FM. Please continue to like and share and come back again. Come join us again. Thank you so much.
Thank you. Bye-bye.
You're listening to the Community Health Watch Show on WNHHLP 103.5 FM, your home for community radio. Stay informed, stay connected, and take charge of your health. We'll see you again next time right here on the Community Health Watch Show.
All right.
All right. Thank you, guys. It was great. It was fun.